I'm Dr. Lisa Larkin, and I'm excited today to announce the launch of HERmeducation, the social media education arm of HERmedicine. I'm launching HERmeducation for two reasons. One, I want HERmedicine, and I personally want to have a voice in the ongoing conversation about menopausal hormone therapy and the data surrounding that. I hope to engage in conversations about how the label should be changed on hormone therapy as this moves forward. The second reason I'm launching HERmeducation is because I see the polarization among us in the areas that we frankly don't all agree on. I would like HERmedicine and HERmeducation to be a platform where we can respectfully and professionally discuss areas where we don't agree because of conflicting data, lack of data, or different interpretations of the data out there. What I want to remind everyone, we agree on more than we disagree on. We are all on the same team. We want the same thing for women. We want to advance quality, evidence-based care at midlife. We want to improve access to menopausal hormone therapy, which we know is beneficial and safe and effective and has far more benefits than risk for the vast majority of women. We also agree that the vaginal estrogen label is wrong and needs to be removed. But we have to acknowledge in a professional and respectful way that there are fundamental and frankly large areas that we don't agree on. And I would highlight the disagreement we have in both guidelines and interpretation of the data is the use of menopausal hormone therapy for primary prevention. I want to remind everyone that the reason the WHI was launched was because we had observational data in the 1990s that suggested that menopausal hormone therapy was good for primary prevention. I was using menopausal hormone therapy in practice for a decade before the WHI data came out because I believed, based on that observational data, that the data supported primary prevention with menopausal hormone therapy. The sum total of body of data now and guidelines from the U.S. Preventative Services Task Force do not support primary prevention using menopausal hormone therapy still. And yet, there's reason that many clinicians interpret the data differently and believe that we should be using menopausal hormone therapy for primary prevention. This is a legitimate area of debate where experts can disagree, and that's correct. We may not all agree, but we should be having collaborative, real conversations about primary prevention and what the data shows as we think about moving towards supporting a label change on systemic hormone therapy. The other areas where we clearly don't agree, and again, there's legitimate reasons, is in the data around menopausal hormone therapy and dementia and cognitive decline and Alzheimer's disease. And the other area that I'm particularly passionate about is what the data says surrounding breast safety and how we should be conveying that information in the label. We all know the impact of menopausal hormone therapy is small, and it depends on formulation and dose and duration and many other things. And not all formulations are the same. I don't think we acknowledge enough that Premarin is different than estradiol in terms of its impact on the breast. And we have to think carefully about how we would change the label based on formulation and dosing and what the data really says between different products, estradiol versus Premarin. And I think we should be very careful when there's messaging out there that the label on systemic hormone therapy is going to be removed. Do we really believe the data suggests it should be removed? Because that would then imply that breast cancer survivors across the board could take menopausal hormone therapy. And I don't think we agree on that. So again, it's not that we are not on the same team, we are on the same team. But in specific areas, we need to come together collaboratively to look at the data, to help move guidelines forward, and to help craft and influence and shape as best we can what is about to happen, or what Dr. McCary says may happen in terms of modifying the label. So I hope that HERmeducation is going to be a platform where we can come together respectfully. I'm going to have social media posts that I know that not everyone out there is going to agree with, and I respect that. I want you to step back and remember, I'm at the end of my career. I'm doing this, I'm speaking out because of my passion for the space. I've been working in this space for 30 years. I care about the messaging. I care about women. I want accurate, transparent, clear messaging, and I want all of us to come together because the best way for us to move forward is together. And so I hope you'll join me on HERmeducation, join me on HERmedicine for our Monday night discussion group, and please, I'm working on the 2026 schedule. If you want to be a speaker, have a topic, are interested in referring someone to discuss a topic, please reach out to me at HERmedicine because I'd love to hear from you. And finally, if you disagree with my posts, and I'm sure many of you will, please comment in a professional way and give me references where you can. I'm happy and I'm open and I want to be collaborative and I want to hear what you have to say. I hope you'll do it professionally.